Hello, and thank you for joining this webinar on the implementation of State Bill 929 and Assembly Bill 118 related to quarterly data reporting for the Latterman-Petras Short Act. My name is Kate Roberts, and I work for Aurora Health Group, and we are helping DHCS facilitate today's webinar. Before we jump into today's session, we wanted to cover a few housekeeping items. Next slide, please. If you have a technical question, please send a direct message to Chelsea Kelleher from the Aurora team utilizing the chat. She will be able to assist you. Feedback can be submitted via the Q&A feature on your Zoom control panel or the chat feature. Due to the webinar format, you may not be able to see what other participants have entered into the chat. Know that we are able to see those responses and plan to collect them all to provide both a brief overview here regarding feedback, as well as compile and assess for later support related to SB 929 and AB 118. So DHCS looks forward to hearing from you. So to guide the feedback being submitted, there will be a series of prompts between segments of this listening session. We will provide about 1 to 2 minutes for each prompt for you to provide your brief feedback. DHCS will not respond to feedback on each prompt. Rather, they will aggregate feedback and make it available after the listening session. Today's materials will also be available later on after the listening session. I will now turn it over to Janelle Ito-Orell from the Department of Healthcare Services, who will provide us with a brief overview of today's webinar. Next slide.
Hi, everyone. Thank you, Kate, for that introduction. And I just want to say welcome to all of you who are joining us today. We really appreciate you taking the time out to meet with us, to go over just a lot of stuff that's been happening with the recent updates to all of the reporting requirements. And we really wanted to take today as an opportunity to really connect with all of you, and you can hear from us directly about some of the changes that have been happening as we have been issuing out information via, bins and information notices. We understand that also you might just want to be able to verbally hear it from us as well. So this is really just kind of an introduction today to kind of talk about, what some of the changes have been, kind of walk through it, and then just give all of you an opportunity to provide some direct feedback so that we can take it back and see what changes as well that we might need to be making. So today we do also have joining with us Carla Sierra, who is one of our managers in our mental health licensing section, and also Randy Jose, who will be assisting with a lot of the data collection on the IT side. And so they'll both be walking through some portions of this today. So next slide. So again, some of our goals today is really just to try and help educate both the counties and stakeholders who are listening about the requirements that were set forth in SB 929, and then shortly there that followed with AB 118, and that also had changes in requirements to the data reporting. So AB 118 followed SB 929 after when there were changes, and 118 made changes to 929. So again, just overall today, we just wanted to provide an opportunity to speak with all of you and provide information. We understand that there's a lot that has changed and that it's confusing. It's confusing for us as well, I will say, and uplifting and starting a whole new system. We have been working for many years on a paper system, I guess you can call a paper system, but it's just not the most effective. Right. And so that's really what we're trying to do. So we're trying to create new systems that are more efficient. It's easier to track. It's more timely. And we're hoping really that it's just easier for all of you as well. Now, it doesn't mean that it's not going to be without some bumps along the way. So again, we also appreciate all of your patience and understanding as we kind of work through some of the best methods and options to do this reporting. But again, really trying to first and foremost, move away from that paper system we've been using for so many years. So again, that's really what Carla and Randy are going to kind of be walking through today. So please, submit questions and comments to the chat that Aurora is going to be collecting, and we will definitely be going through all of those and looking to see, if you have feedback on ideas to make it more efficient, we'll be, looking at all of that. So again, those are really kind of our ultimate goals for today. And so I will now then be turning it over to Carla to start kind of walking through.
Next slide, please, Millie. Good afternoon, everyone. My name is Carla, and I'll start this off with an overview of the Lanterman-Petrus Shore Act, also known as the LPS Act. So just some background, our department, DHCS, is responsible for approving county designated facilities throughout California for LPS Act holds. The LPS Act was enacted in 1967 and went into effect on July 1st, 1972 for the purpose of ending the inappropriate, indefinite, and involuntary commitment of persons with mental disorders, providing prompt evaluation and treatment of persons with mental health disorders and persons impaired by chronic alcoholism, guaranteeing and protecting public safety, safeguarding individual rights through judicial review, providing individualized treatment, supervision, and placement services by a conservatorship program for persons who are gravely disabled, encouraging the full use of all existing agencies, professional personnel, and public funds to accomplish these objectives, and to prevent duplication of services and unnecessary expenditures, and protecting persons with mental health disorders and developmental disabilities from criminal acts. Next slide, please, Millie. So an overview of Senate Bill 929 and Assembly Bill 118 as it pertains to the Welfare and Institutions Code Section 5402. Both these bills, Senate Bill 929 and AB 118, are a revision of the LPS Act with a goal to improve data collection and service transparency. Both bills expand DHCS's data reporting requirements from counties, LPS designated facilities, and other entities responsible for implementing 5150. So these bills require data from each designated and approved facility and other entities involved in implementing the provisions relating to involuntary detention, assessment, evaluation, crisis intervention, or treatment. The required data is county specific. So this means that the data reported is specific to the county in which it operates. Also, required data, the required data includes, but is not limited to, the following: demographic variables, clinical outcomes, waiting periods, services provided or offered, and numbers of county contracted beds. And each county behavioral health director is required to report this data quarterly to our department. Next slide, please, Millie. The Judicial Council also has a new set of data reporting responsibilities. The Judicial Council shall provide our department, DHCS, by October 1st of each year with data from each superior court to complete the report, including the following. So they'll be submitting data to us, including the certification review hearings held pursuant to Section 5256, the petitions for writs of habeas corpus filed pursuant to Section 5275, the judicial review hearings held pursuant to Sections 5276, the petitions for capacity hearings filed pursuant to Section 5332, and the capacity hearings held pursuant to Section 5334 in each superior court. Next slide, please, Millie. So SB 929 and AB 118 data reporting changes. Both these bills now require DHCS to publish on or before May 1st of each year a report including quantitative de-identified information concerning the numbers of persons in designated and approved facilities detained or admitted and treated involuntarily under several sections of the Welfare and Institutions Code. Within this May 1st report, DHCS is also required to collect from each county required data from other entities involved in implementing Section 5150. We're also required to collect data on the number of persons transferred to mental health facilities pursuant to Section 4011.6 of the Penal Code, the number of persons for whom temporary conservatorships are established, and the number of persons for whom permanent conservatorships are established in each county. Furthermore, the report must evaluate the effectiveness of achieving the legislative intent of Welfare and Institutions Code Section 5001. As a reminder, AB 118 does further require county-level behavioral health directors to submit this data directly to DHCS quarterly. Next slide, please, Millie. So an overview of Senate Bill 929 and AB 118 data change implementation. DHCS, so we're working on developing, well, we have developed a phased implementation plan to ensure stakeholder input and long-term sustainability. So as Janelle was mentioning earlier, our goal is to have you guys involved and provide feedback to us. We are breaking up this bill, Senate Bill 929, into phases. We do plan to roll out each phase in a stepwise fashion over the next 2 years. So if you guys aren't familiar already, we did issue out a phase 1 bin that was released on April 6, 2023. And we did introduce you guys into individual demographics as newly required data elements. We also rolled out an online data collection platform that was a transition from our previously used PDF forms to kind of facilitate an easier way for us to modify these new data elements rather than just modifying a PDF and issuing out these new PDFs to everyone. So that was our phase 1 bin that we released earlier this year. We did also release a draft phase 2 bin, which has been released for stakeholder feedback. If you guys would like to be added to the list for stakeholder feedback, you could please email DHCS at mhdata@dhcs.ca.gov. We're also currently incorporating stakeholder feedback and finalizing our AB 118 draft bin as well. So I'm going to hand it over to Randy. Randy's going to talk a bit more about those phases that I mentioned earlier in a bit more detail for you guys.
Next slide, please. Hi, everyone. My name is Randy Jose, and I work in the Enterprise Data and Information Management Division here at Healthcare Services. So currently we have established 7 phases to implement the new data element requirements for SB 929. We have included phase 0 on here to recognize and acknowledge the way we collected data in prior years, in which counties and providers would submit data through a PDF form and submit it through email. For phase 1, the department decided to switch from PDF form submission to an online HIPAA compliant platform. With phase 1, we also added several new data demographic elements, such as age groupings, sex, gender identity, race, ethnicity, sexual orientation, veteran status, and housing status. For phase 2, we will be requiring counties to submit an additional demographic data element. That data element is primary language that beneficiaries utilize. We will also be asking that counties report on sequence of hold and county bed numbers. We will go into more detail about this in the following slides. For the following phases, the department is still working on best ways to provide guidance on collecting the data elements required. For phase 3, the department will work on implementing ways to capture services provided or offered to individuals as it pertains to conservatorship. For phase 4, the department will work on implementing ways to capture clinical outcomes for individuals as it pertains to conservatorship. For phase 5, the department will work on implementing ways to capture waiting periods for individuals prior to receiving an evaluation in a designated and approved facility pursuant to section 5150 or 5151, and waiting periods for individuals prior to receiving treatment services in a designated facility, including the reasons for waiting periods. This will also factor in those individuals who go to the emergency room. For phase 6, the department will work on implementing ways to capture clinical outcomes and services for those individuals as it pertains to 5150s. And finally, phase 7, which will require the department to analyze all the new data elements required and collected and prepare a report that includes all these new data elements. And I will go ahead and hand it over to Kate.
Thank you, Randy. Next slide. So now we are at our first question. And as we mentioned before, please submit your feedback either in the chat or in the Q&A. And we'll give about a minute per slide, minute or two per slide for you all to provide your feedback. So this first question is, what barriers do you anticipate in meeting these new data reporting requirements? All right, we're seeing some questions around the concern around these data requirements and how to collect them. And unsure of how to track some of these, and a barrier that this might take more time. All right, next slide, please. What infrastructure changes do you anticipate needing to make these new data reporting requirements? We're seeing some feedback on how that some of this data comes from entities outside of our control, and that there might need to be some clarity and guidance on how to engage outside entities. Concerns about the sensitivity of the data, I see popping up. As well as questions of if this can integrate with electronic health records, or possible codes. Some of you are talking about staffing concerns. All right, next slide, Millie. And last question for this portion of feedback. What assistance would be helpful from DHCS in meeting these new reporting requirements? We're seeing some feedback regarding clarity around some of the terms, specifically the difference between assessment, evaluation versus treatment within these settings. A desire to understand each data point and what is actually being requested and guidance related to that. See quite a few requests for knowing who to contact, should questions come up. Some of you are talking about the local nature of these challenges and wanting to connect with DHCS about those local challenges to provide appropriate technical assistance. And there's been quite a few about establishing built-in reports related to electronic health records within updating the data collection process. All right, and I'll turn this back over to Randy as he continues to walk us through the next part of this webinar. Next slide, Millie.
Thanks, Kate. So for phase 1 data collection, a BHIN was released in April of this year, as Carla had mentioned earlier. Within that, we had notified counties that we'd be transitioning from a data collection through PDFs and emails, and we would be going on to a digital platform, which was ArcGIS Survey 123. Currently, we've been experiencing some technical difficulties with ArcGIS, and so we will be shifting to another platform, online platform, and we will try to keep the forms as similar as possible to those that you've been used to reporting on. More information will be coming forth regarding that. And also with phase 1, we also introduced the data elements, the demographic data elements that we were requesting from counties and that I had previously spoken about. Next slide, please. So for the current data phase that we're in is 2. SB 929 and AB 118 requires an additional data elements, such as new involuntary treatment data collection elements, which include the following. On top of phase 1 data elements, which is the primary language that is utilized by the individuals, sequence of holds, and number of county contracted beds. Data collection will be outlined in the phase 2 bin, of which DHCS has published a draft for public feedback. Next slide, please. So the primary language utilized by those receiving care, that language includes sign language, which must be used by, that language including sign language, which must be used by an individual to communicate effectively and which is so identified by the individual. That's one of the new data elements that we will be adding, as well as the current demographics that we're requesting. We're also requesting the sequence of holds. That's the number of persons admitted or detained either once, between 2 and 5 times, between 6 and 8 times, and greater than 8 times for each type of detention, including 72-hour evaluation and treatment, admitted for 14 days, additional 14-day hold, 30-day periods of intensive treatment, and admitted for 180-day post-certification intensive treatment. We're also going to be asking that counties submit data requiring county contracted beds. That's all beds that the reporting county has contracted with the treatment of individuals who are detained or admitted for 72-hour assessment, evaluation, crisis intervention, admitted for 14-day period and 30-day periods of intensive treatment, and admitted for 180 post-certification intensive treatment. Next slide. And I believe that's for Kate.
Yes. All right. A few more questions to solicit your feedback. What challenges did you face meeting these initial data collections related to phase 1? I'm seeing that buy-in from hospitals was a challenge. Challenges around reporting the level of data, the use of contractors and needing to report that clarity to contractors, especially with coordinating with counties. See that some systems might not have some of the data requirements that's being asked of them, especially the demographic data element. All right, next slide, please. What support do you need to reach these data collection goals going into phase 2 specifically, and looking at those elements that Randy so helpfully articulated for us? Seeing a few responses around that these data elements are not always captured during evaluation hold process, and so it may have to be omitted, especially during more intensive services. Some people are talking about being unclear as to what data they're responsible for if they do not have county beds, or concerns around providing data prior to the period, not afterwards. So a lot of feedback on overall clarity and data definitions. And a lot of you have mentioned leadership and needing buy-in from your own leadership. All right, next slide, Millie. And lastly, would you be open to sharing your process with DHCS? If so, you are welcome to email DHCS at the email that's been provided, mhdata@dhcs.ca.gov. DHCS is more than happy to hear from you about your process, listen more directly to your feedback. All right, next slide, Millie. All right, and I'll turn it back over to Janelle for some final remarks.
Great, thank you. So just kind of taking a look at some of the questions that are coming in as well, and recognizing there some of the challenges. And I got to say that this is really helpful to kind of get your feedback. So we can kind of also look at where there's areas that we need to kind of, be more clear or help provide more clarity. One thing I did want to kind of mention is that on one of the slides where it talked about the different data elements, and it was kind of called out like 1 through 4 and 10. I just wanted to clarify too that if you go into the actual bill of SB 929, within the section 5402, there's the new data elements that are required, and that's kind of what we're referring to as well. So that might help also give you an idea kind of going forward of all of the data that SB 929 does now require that we are implementing in these phases. Again, we issue out our bins when we talk about what new data is going to be required to be submitted. We do put those out and we send it out from our deputy director through the e-blast and provide at least a 2-week or so opportunity for stakeholders to provide any feedback on our bins so that we can make any changes before we finalize them. So again, we encourage you to communicate through that, because if there's something in that bin that's not clear, we definitely want to know and we want to issue out clear guidance. Because I did see some of that feedback that guidance isn't clear. And so we want to make sure that it's understandable for everybody. And so if there's something that's not quite clear or not understandable through our guidance, please do let us know. We're definitely want to make sure that this is all workable, because once those bins are up, we know that that is what you all are going to rely on to go back to. And so we want it to be clear. So definitely appreciate any feedback there. As mentioned, we do have the phase 2 data collection bin out right now for feedback. And that is on our website as well. And through our bulletin section on our website, and it is as a draft. And so that is an opportunity still right now to provide some feedback if it's still not clear what's going to be required for phase 2, kind of going into the next round. So what we really are doing is we implement phase 1. So we're looking at already collecting that data, and then we're going to add new elements now on top of phase 1, and then adding phase 2 data collection elements. So that's really kind of the process of what we're looking at as we move towards the full implementation of SB 929. So again, it is an opportunity for you to provide feedback at this time if the guidance isn't clear, and still encourage any additional questions to email us and let us know. But we really do appreciate everyone's involvement here. Just the questions that we've had so far, as I kind of was perusing through them, I'm like, this is really helpful. I mean, again, just helping us to know kind of going forward where we might need to tidy up a little bit, and how we can just help all of you in the best way that we can in meeting the requirements of this bill. So again, I just appreciate all of you joining us today, and look forward to kind of going through everything and then putting some responses out. Like Kate mentioned in the beginning, we are going to put all of this together and do aggregate, and we'll probably put something back out in kind of an FAQ type of manner and post it, so that again, it would also be some of the questions that were raised here. It's going to be kind of publicly accessible to kind of go back to in the future. So thank you again, everyone, for joining us today.